will do our introductions. And so thank you for coming, everyone, on this last day of Reorientation 2024. And today we have Elisabeth Bailey, who has very kindly agreed to come and just provide some overview of our undergrad program. She's the Associate Director of Undergrad Programs, and I think you have a few slides, as we've done before, just to kind of give us a sense of the lay of the land. And there'll be time for some discussion later on.
Thank you, Allison, and thanks people who are here in the room and maybe other folks who just watch this overview of the undergraduate program later. But I'm excited to get to share a little bit about our fantastic undergraduate nursing program. I want to start by just acknowledging where we are. So we're here on Musqueam territory in our physical space of UBC Hospital today, but the picture I've chosen for this slide is of the reconciliation pole, which is just about a 5-minute walk from here. And I often share this image because, for one, it's very close to where I live. So I live here on campus, and I have the joy of getting to see this amazing piece of art and sculpture on my walk to work, but also because I'm going to share today about our undergraduate program, and one of the things that I think is particularly amazing about our program is the commitment to Indigenous cultural safety and truth and reconciliation work that is threaded throughout the experience of the undergraduate program, right from admissions through to the end. And to me, the idea that education is this really foundational part of truth and reconciliation work, I think is just really closely related to the opportunity that we have in our nursing program to teach about the history of colonialism in the healthcare system here in Canada, nursing's role in that, but also to learn from our students, many of whom come in with really unique perspective, experiences that contribute to all of our learning here. And I think the reconciliation pole that sort of starts at the bottom with representation of pre-contact and then kind of moves its way up through what you can see at the bottom of the picture here is a representation of residential schools and quite a time of darkness and tragedy and trauma, but then represents reclamation and resurgence and resilience. And so it's this really beautiful representation, and I hope that we are able to teach about that and really bring that into our program in a fulsome way. So the quick overview of the BSN program. I think most people here know this, but just in case you don't, it's an accelerated program, which means students come into the program and complete their Bachelor of Science in Nursing in 20 months from start to finish. And they have about a month off there, the August. So this is the time when students have a little bit of a break, but otherwise they're really going full steam ahead for most of those 20 months. We also call it an advanced standing program, and that means that all students who enter into the BSN program must have at least 48 post-secondary credits, although the majority of our students come in with a previous degree, sometimes more than one previous degree, and so they bring with them quite a lot of academic experience, and for most students, quite a lot of life and sort of professional experience before they come to our accelerated program. So the average age of our BSN student is usually ranges between 25 and 27, kind of depending on the year. So again, many folks coming back for a second degree. We, as of a few years ago, have 150 students per cohort. So we were asked, like most nursing programs in the province, to expand our undergraduate program a few years ago. So we grew from 120 students per cohort to 128, and then to where we're at currently, so 150 per cohort, and we usually have 2 cohorts running at a time, so 300 undergraduate students most of the time in our nursing program. And we have a single start, so new cohorts start in September, so we'll be welcoming folks at orientation next week. Our goal in general in the undergraduate program is to prepare graduates with the knowledge and skill they need to excel in clinical practice. So our first and foremost goal is to have confident and competent nurses who can enter into practice ready to go, but also who have the foundational knowledge and practice to lead in clinical practice environments. And so for those of you who know our curriculum, and I'll talk about it in a moment, there is an emphasis on leadership and opportunities to really think about and learn from our faculty, many of whom have really strong leadership roles. And because students come in oftentimes with previous work experience, many of them have been in leadership roles in other professions before, so there's often a strong interest in that aspect of the program as well. So what I've tried to represent here are sort of the pillars of what we teach in the program. So of course we want all of our graduates to be nursing professionals who have strong competencies when they're working with individuals, with groups and populations across continuums of care. We emphasize a knowledge of evidence-based practice and also critical appraisal for delivery and also design of healthcare interventions. And we focus on a knowledge of healthcare systems and policies, and then again, leadership approaches to be able to shape the future of the healthcare system. We do all of this with a solid theoretical foundation for practice based across the whole curriculum. And another important part of the reason why students choose to come to UBC is the ability to engage with faculty and nursing scholars who are able to lay the groundwork for graduate nursing preparation and also for leadership, whether that's through advanced practice or through roles in education, research, or administration in the future. One thing we know anecdotally about our graduates is that they do tend to move through into leadership positions quite rapidly once they exit out into practice. So in a different way that's maybe less represented in a way that I can show you visually, I think we emphasize or prioritize a few key ways of being in the undergraduate program, and a few key places where we place our emphasis in our teaching. First and foremost, that's on professional practice, so asking students to reflect on what does it mean to be a professional nurse, grounding them in professional practice standards and ethics, and understanding nursing knowledge and practice. We hope to develop reflective practitioners, so inviting them right from term one to reflect on why did they choose nursing in the first place, why this particular path, what will keep you going in your practice, like what's going to sustain you over the long term, how will you continue to strengthen your knowledge and your practice expertise, so how are you going to take up the lifelong learning that we know is part of nursing practice. We are strongly grounded in relational inquiry and relational practice. So how do we understand the populations and individuals that we work with, what shapes their context, and their engagement with healthcare, like what influences their willingness or perhaps hesitation to engage with healthcare. And how do we, as individuals, with our own story, our own experiences, and our own sort of ways of relating to the healthcare system, how does that shape our practice as nurses and the way that we engage with individuals, with families, with populations? And then finally, we, I think especially post-pandemic, appreciating, or perhaps it was highlighted, the real challenges of healthcare practice. We try to thread the idea of thriving practice throughout our program, and that shows up in part through the self and collective care modules that we introduce all the students to, and the way that we continually come back to the idea that building our own self-care toolbox, our ability to take care of ourselves, is actually foundational to nursing practice, that it allows us to be effective colleagues, but also it allows us to plan to have longevity in nursing as a career so that we can shape the future of healthcare to be a more humane system, to be a place that does not lead to things like burnout and compassion fatigue. But in order to stay in it for long enough, we have to build a solid foundation and to look out for one another. So we intentionally build that in throughout the program. This is a really impossible to decipher from here overview of the curriculum. So I won't spend a long time on it, but this is available on our website if you want to look at it. And it just lays out the focus of each term and then the specific courses that students take. One thing that you can see kind of at the bottom here is just about how many hours per week students are in class or clinical practice. And if you can't read the fine print from here, but if you also take into account that most sources say you should be taking about 2 hours a week per credit to prepare and study, and we ask them to prep for clinical, we're really talking about 50 or 60 hours a week of study and time. So it's quite a full-time, if not a little bit beyond full-time experience for our students most of the time that they're here in the program. So this is a really simplified version of that, which hopefully is a little easier to understand or to make sense of. Essentially, we move students through learning environments that start out as less complex and more predictable with a higher degree of support from their nursing practice educators and practice course leads. They start out in term 1 with adults and older adults in lower acuity contexts. Term 2 moves into one of our specialty course terms where they 150 students move as one cohort through Med-Surg 1 with adults and older adults. They divide into 2 groups of 75. In term 2, half go to pediatrics and maternity or work with childbearing families, while the other half complete their clinical and coursework in primary healthcare and mental health care contexts. In term 3, they all come back together to do the second of the adult Med-Surg courses, now in higher acuity contexts. Term 4, they reverse, so the 75 take the opposite set of specialty courses, and then we move into term 5, which is their consolidation term. So that looks like 6 weeks of kind of intense review at the beginning of the term, and then they're out into their preceptorship, individualized preceptorship practice in different areas of practice. So during this time, as they're moving through different patient populations and contexts, the learning environment tends to get more complex, less predictable, and they're expected to have more independent practice. So if you look at our practice competencies, the way we sort of evaluate students as they move through the terms, the level of independence, the complexity of decision-making that they're asked to do, and the complexity of tasks that they're asked and skills that they're asked to demonstrate gets increasingly more complex across the 5 terms. So for each of these terms, there is theoretical content that relates to their practice environments. So, there's a Med-Surg theory course that goes along with term 1 practice experience as well as lab practice. And then there are additional theoretical courses that really emphasize and build across the curriculum in areas like professional nursing practice, relational and ethical practice, the health promotion for Indigenous peoples and populations, critical inquiry, leadership and policy for health systems, and then informatics. So the way we sort of think about it with students is throughout your theory courses, you're learning about the why, and in all your practice-based courses, which would be a lab, clinical practice and simulation, you're learning the how. How do we do this? How do we enact this and put it into practice? One thing that comes up a lot, both from our students and also sometimes from people in practice, is it's an accelerated program. So how does student clinical practice experience compare with longer programs? It's a little difficult, honestly, to dig this information out, but I was really curious, and so I did some digging in the literature about North American BSN programs. It's a little bit easier to find this information out about programs in the US. There's just like more info available. But what I could find was that on average, most BSN programs have about 925 clinical practice hours. And then there are, at least in the US, a variety of minimum practice hours in order for you to be licensed as a professional nurse in different states. And the minimum number of practice hours is like anywhere from maybe 500 to 840. So most programs go beyond the minimum there. In our program, if you looked at the total number, you'd see about 1,200 hours. But it's important to note that not all of that is like physically on a unit caring for patients. It's about a 1-to-3 ratio. the one part being things like on-site prep for clinical practice, so looking up your patients for the day and post-conference, as well as other kind of preparation for being in different health authorities. And then 3 parts actual clinical practice, where you're like on a unit and providing care, or in a community providing care for patients. So if we look at just the hands-on practice, it's about 965 clinical practice hours in our program. And that includes 312 one-on-one preceptorship hours. I point this out because while it is true that we're an accelerated program, it isn't true that our students don't have similar or equivalent clinical practice experience from students who are in longer, traditional nursing practice programs. What is different is the speed that they move through these experiences. So it is for sure true. There's less kind of time to really ponder your development as a nurse. There's a lot that comes at you in nursing practice. Our students are in adult and older adult care within a couple weeks of arriving in the program, and for anybody who practices or has practiced in those environments, that means they're up close and personal with human suffering, with patients dying, with really difficult realities like a month into their nursing program. And so while we really do offer, in terms of total number of hours, hands-on time and a lot of time for them to practice their skills, what is harder is just that time to consolidate and make sense of the experiences you're having. And that's part of the reason we've tried to introduce more around self and collective care, community building, just opportunities. Our students don't tend to struggle with the academics. Like, they get it. That part comes easier. It's what does this mean that I've made this decision to become a nurse, that I'm going to be part of people's lives in these really challenging moments? Like, that's what's harder to do in 20 months. And so we're trying to enhance that continually, to try to give them more opportunities to just really think that through, to talk to their teachers, to talk to one another about how they're making sense of that transition. But I do think it's important, because a lot of times people think, oh, it's a faster program, like they don't have as much experience. And looking at the literature, that's not necessarily true. What they have less time to do is, sort of process and take more time to reflect on those experiences, which is part of the reason we build in so much reflective practice, to try to create space for that. So I think we have a great program, but it's not without its challenges. I wanted to highlight a couple of the key challenges and also some of our real strengths as a program. No surprise to anybody, one of our main challenges right now is that practice contexts are stressed, and honestly, they're stressful for students and for teachers. That was true pre-pandemic, during the pandemic, and post-pandemic. The environments that we're sending students into are frequently understaffed, and with patients who are presenting with more acuity, and so it's a lot to take on board. We ask a lot of our nursing practice educators to introduce skills, but also, again, to help students kind of deal with and process some of the inequities that they experience right away as they transition into practice. We also know that in our healthcare system here in British Columbia, a lot of folks in leadership positions are newer to their own practice, and so there's a lot of learning happening at all levels of the system. So that is that's not unique to our program, that's just true for all healthcare education right now. It's just a stressful time. I mentioned earlier we were invited to expand our program, and we did that over the last couple of years. Interesting twist in that expansion is that it didn't necessarily mean that we were guaranteed more clinical practice placements. So, and given the stressors on the system, we have had to be quite creative, like a lot of other programs, and look at things like the integration of simulation into our program, and in order to perhaps not overtax our practice partners, and also given the complexity of experiences in practice contexts, offering some additional learning experiences in simulation that are a little bit more controlled and predictable. The challenge is simulation is fabulous. It's a wonderful learning opportunity, and it is very resource intensive. So it's not true that anyone can just drop into the simulation lab and start teaching. Like, there's a simulation pedagogy, there's training that has to happen, and upskilling. there's equipment that needs to be taken care of. It's staying current, it's developing scenarios, it's understanding how those are going to fit and be practice relevant and be evaluated. And so though it's a great option, and I would say a needed option, especially in the practice context that we're in now, it requires a lot of human resource and a lot of investment. So the benefit is we're moving, or like a pro is that we're moving into a new building with a beautiful simulation suite. A challenge is just making sure that we're able to upskill and be planful about really being able to take advantage of that space when we move in. And also, yeah, just staying current and keeping on top of the simulation experiences that we're offering currently. Another real challenge is just recruiting and retaining nursing practice educators. So there aren't enough nurses in practice, so getting some of those nurses to come and teach our students is a challenge. Just finding folks who are available and willing to do that work. And then of course, you know, there are a number of other schools of nursing in Vancouver, and so we're always, if not in competition, we're always recruiting alongside these other schools of nursing. So that's just a challenge, finding folks with the right mix of experiences. Another thing about our curriculum that you might have noticed is that in the summer term, we're only running med-surg courses, and so there are periods of the year where we need people with med-surg experience. And so when we look at hiring continuing nursing practice educators who would be full-time with us throughout the year, we need somebody we need folks who can teach in med-surg throughout the year, as well as perhaps have additional specialty training. So it just narrows our pool a little bit, and that's sometimes a recruitment issue. Despite those challenges, there are a lot of strengths within our school and within the program. We are incredibly lucky in the undergraduate program to have committed expert teachers who bring incredible clinical practice expertise, but also really are excellent educators and are innovative and just incredibly thoughtful about the way that they teach and engage with students within this accelerated program. So I can't say enough about our teaching team and what they bring. We have really strong students. So we have students who come in with a lot of experience. They tend to be very strong academically, but also have these really rich previous experiences that make this type of accelerated program unique and kind of exciting to be part of as a teacher, but as a student. I think a lot of students who come to our program have a particular interest in leadership around equity and social justice, and so that makes for really wonderful conversations, and also it's just really exciting to hear about what students plan to do and how they're taking up nursing with their own, like using all of that previous life experience to inform the way they're going to take up nursing in their own way. And of course, we're here at UBC Vancouver, so we just have this incredible collection of nursing scholars and leaders and change makers that are such a resource to us as a program and to our students. And so there's something that's just difficult to replicate, right? We just have this learning environment that that's pretty phenomenal. So despite the challenges that, again, are not necessarily unique to our program, it's just part of nursing education right now, there's a lot that I think is really positive about UBC Vancouver specifically, and that's why we still are able to fill these classes. When all of the nursing schools expanded in the province, and then the pandemic hit, we are in a situation where some schools, can't fill their cohort, and we've been lucky to be able to continue to do that. So clearly there's something, we have things that people are looking for in this program. I guess kind of transitioning from talking about the curriculum and the program and talking a little bit more about the BSN team, and I include everybody who supports BSN students in that team. So it's folks, SSO and our teaching team and the lab team and the simulation team and leadership. And some people teach throughout the program, and some folks come in and teach in a course or two. We consider them all part of the BSN team. When I came into this role as associate director last year, we took time at our December BSN forum to talk as a team about, especially coming out of the pandemic and settling into what this program is going to look like moving forward. We wanted to take some time to say, what do we value as a collaborative team working together to deliver nursing education, and what are our goals? And that was a really interesting conversation, and we gathered feedback from everybody who participated and then sort of looked at themes and came up with these 4 kind of core values and some goals that we have for ourselves as a team. I will say at the outset, I don't know that we've completely achieved all of these goals, but it's something that we think about, and I think I try to hold up as like, these are ways that we're trying to be together as we navigate nursing education, which is stressful and challenging at times in this particular context. So one thing is we really respect all of our team members' perspective, skills, and expertise. As I said, people come in with just this huge wealth of experience, but we also know human resources are always a challenge in nursing education, so we have to be really confident in letting people work to the full scope of their experience and really appreciate that all of our team members are strong and can take on that work confidently and well. Having a clear understanding of our own roles and responsibilities is really important in that, and understanding, what's my job and what's your job, so that we're not duplicating work is pretty important. So something that we're working on. And then just really trusting each person on the team to work to the full scope of their role and to follow through on everything. So we want to enter into our working relationships just believing that to be true about everybody on our team. We value clear and transparent communication, so that means really trying to take the idea of team to include everybody, and trying to make sure we're not only listening to the voices of certain folks in the conversation, encouraging feedback and questions, trying to do that in a way that's not, so sometimes we have to make decisions that obviously are not, that don't align with the way everyone would want to move, and just trying to have an attitude of non-defensiveness, but like, hey, let's talk about our differences of opinions about the way that this program is going to move and change over time, and do our best to make collaborative decisions. And just having open conversation about the way we're moving as we go forward. Part of that, I think, is really important to clearly articulate rationale for decisions when they happen. So just because, as I mentioned, like with simulation, it's resource intensive. Prioritization has to happen. We have to make decisions about what can be included in the curriculum and what maybe needs to be taken up elsewhere. We can't ever sort of say yes to every single idea that comes forward, but I think if we say no, it's really important to have a clear rationale for why and how we might attend to some of those ideas differently. And the other thing is that there are decisions that get made that will impact the way people's work plays out, particularly in practice contexts, so just making sure people really understand why things happen. Finally, the last 2 are believing that rest is a right and not a reward. So we all come from practice contexts. We know that it can be in academic context. There is no neat start to end of our workday. We could work all the time if we wanted to, and sometimes that's what happens. We had a long conversation about this as a team, and really discovered a few things. One, recognizing that downtime and rest is crucially important to the kind of work that we do, which is very creative, actually, in a lot of ways. That we need to support one another to take time off, so being willing to kind of step up and sign out to one another, and that's part of understanding people's roles and responsibilities so that we can pick them up as we need to. We discovered that there was a little bit of a culture of people feeling like they kind of needed to sneak away to take time off, so we really wanted to bring that out into the open and say you don't have to feel guilty for taking your well-deserved time away. That's okay, and we see it as valuable to one another and to the quality of our work. And the other thing, and I couldn't resist putting this in there because it's a favorite, I guess, reframe of mine, that there are almost no academic emergencies. Like, it's not. Well, many of us come from practice contexts where it was an actual life or death emergency. That's not really the situation in our jobs within these walls. And so, and I have to do this in my own mind frequently, resisting false urgency. Yes, this feels incredibly important, and it is, but it's not a life or death emergency that needs to be attended to this second. And so figuring out how do we identify what is really urgent and then what is something that we can kind of pace ourselves on and work on over time. And then the other thing is just creating a community of support. So that looks like trying to take the time to get to know one another, to really see ourselves as a collaborative team, and to identify and advocate for resources for one another as we need them. So this is, these are aspirational. We're working on them. But I think personally it's really important to sort of have a shared vision for the way that we want to work together. And especially if you're dipping into the BSN team from now and again, this is really a way that, at least at the leadership level, like we really try to live into these ways of being with one another. So the last thing I have to say is just I wanted to share a key resource, and I can share this link out if we can send it out with the recordings. I'll just click here and see if it works. Let's see. Yeah, so over the last year, we created an e-handbook that's really meant to be this kind of one-stop shop. We know it can be a little difficult to navigate SharePoint and OneDrive and Canvas and like all these other places in the UBC academic calendar and like all these other places that you might need to have to go to hunt down relevant information. So this is a living document, and it's available to everybody. It is on OneDrive, and we'll share the link. And I won't make you all seasick by scrolling, but I'll just show what I mean by it being a one-stop shop or a handbook. So we have stuff here that's just helpful resources for everybody. So whatever your role is in the BSN program, these might be useful resources for you. So for example, there's that link to our shared values and practice, to the strategic plan, to roles and responsibilities, documentation from our accreditation reports, that kind of thing. If you're like, how do I make sense of this? Who's who in this program? You can find that stuff here. There's teaching support, so just guides from CTLT and other places. Student support, so where do I go to find support for BSN students? Our lines of communication, so if a student has a question, who do I point them to? As well as other university-wide things like assisting students in distress, the early alert system, that kind of thing. Beyond that, the last thing I'll share is just curricular info. So one thing to highlight is that we do have content maps by term. So for example, if you wanted to say, okay, it's term 1, I want to know what is everybody learning on week 3 of term 1, you can go in and this is so you can look week 1, here's what's happening across the curriculum. So we have that for all terms now, which is kind of exciting. And the goal is, as the syllabi are finalized, this will be updated. So if you're curious, like where does something happen in our curriculum, this is a place you can look. So this is content mapping, not necessarily like outcome mapping, which is something that's happening as well. But the idea is that the whole team could go look and understand how the term is unfolding for students. Similarly, in these content maps, you could see, and again, sorry for scrolling quickly, what are all the assessments that happen and what are the dates for those assessments? So kind of like, what does the student's term look like as it unfolds? So all of this lives within our e-handbook, and you can kind of find your way around there, as well as just the program outcomes and that kind of thing. Last thing I'll highlight in this handbook is that there's a section on resources by role and responsibility. So this is if you're a course lead for any course. It has, the operational responsibility, so preparing syllabus, identifying course schedules and resources, and then it has links related to those tasks. So if you want to find the syllabi template, the link is there. If you want to look at the UBC policy for content and distribution of the syllabi, it's there. It's just meant to make your life a little bit easier as you're trying to navigate the many places to find information at UBC. So again, I'll circulate the link to that. If you have a resource that you think would be really excellent, I kind of maintain this e-handbook, so you can send it to me. Happy to add it in. And it's a dynamic document, so it's just updated as we find out new information. And I think that's it. That's it for me. So thank you for listening. I feel like I went on for a long time, but I appreciate your attention.
Thank you.